and welcome everyone to our Repopulation webinar. You can see today that we have with us interpreters for those who are watching. And so thank you to both of them for stepping in. And so to you all who are watching and those who are watching live and who will watch recording, we're continuing our webinars to provide as much information as we can to all of you when we can. So as you know, California, because you're all watching the news, remains in a bit of a fluid state when it comes to health and safety. The overall news, of course, about the COVID pandemic is good. The number of COVID cases is going down both regionally and locally. And what that means for our campus is that we're predicting that we're going to become more open as time goes by. And we're going to do that cautiously and carefully, and certainly in alignment with local health and safety guidelines. So what that means is that all of us, the staff and employees, faculty and administrators of the university, will be coming back to campus in accordance with the needs of the campus and the students who we serve. And let me just repeat that because it's a really crucial point. All of us, all employees, will be brought back to campus to meet the needs of our campus and our students. What that means is that not everyone is going to be coming back in one fell swoop. When students or the campus needs it, we'll be bringing back the staff. On the other hand, our local state agency, Cal-OSHA, Safety and Health Agency, still has not directly given us guidelines for social distancing and capacity for the fall. We think that that will be coming, and we think that the current 6 feet distance, masking and so on, the current guidelines will be relaxed going forward, and that's how we're planning. So today's webinar, even though it will answer some of your questions, is mostly a report back to you who have not been on campus about what does the campus look like and feel like. Most of us have worked at home for the past 15 months. And so it's hard for those of us who have done that, which includes me, it's hard to know until you come back. Now, I'm actually back on campus, and those of you who know my office on Brockman Hall on the 3rd floor know that it faces the Child Center just across the road. And so as I look out, I can see lots of little toddlers running around, shouting and enjoying themselves. And as I said earlier to some people, it really warms my heart to see the campus coming back to life like this. And we know that it's safe for those people to do so, safe for the children to be there. And so that's what I see from my office. But what we're going to hear from today is not just me, but from students, faculty and staff who've been on campus in the last while. And we can hear their perspectives and thoughts on what it's been like for them. We're also going to bring in 3 experts to answer specific questions as well. So here are the instructions. Here's your duties. If you have a question during the webinar, just ask it in the Q&A. And we'll do our best, as we did in the last webinar, to get through all the questions today, but we probably won't. And if we have additional questions that need common answers, we'll add them to our current FAQ from the last webinar, which is actually available online on our website. So do check those FAQs. All right, enough from me. I want to briefly introduce the panel, and they will talk about their experiences. So I promised to have students. We have two wonderful students, health ambassadors, Tyler Buss and Jessica Pascual. Staff, we have Chris Frost from CNSM, the Science Safety Officer. We have Vaca, the Facilities Project Supervisor. We have Bryon Jackson, the Assistant Vice President of ITS. And we have Robert Ryan, the Cashiering Supervisor. We have two faculty with us, Tiffanye Vargas, who is currently the CHHS Kinesiology Department Chair, and Miyuki Nakajima, also CHHS faculty. And then our three subject matter experts are Larisa Hamada, who will address any equity and diversity considerations. We have Jody Cormack, who will speak to us about class and course repopulation. And then we have our Dr. Kim Fodran, who will speak to us about medical repopulation. So, panelists, let's start with you, Tyler. Tell us a little bit in 1 minute or less what it's like being here.
Yeah, perfect. So I've been a health ambassador for about when the pandemic first started back in March. So it's about to be 2 semesters, and it's definitely been an experience to say the least. It's almost compared to what campus used to be like. It's a bit of a ghost town. One thing I will say is parking is definitely easier now that there's not so many students as much. But I definitely got the opportunity just to explore the campus and see what it's like. I got to see firsthand students slowly start piling in and trickling down. So that's definitely been an experience. And then for the most part, my job is just making sure everyone follows and adheres to the campus guidelines. And that's just been a positive experience as well. Students have been very understanding of everything going on. And so it's just, thankfully, as a senior, it's definitely been a positive experience and just a great opportunity to return to the campus.
Great, thank you, Tyler. And how about Jessica?
Hi, everyone. So when I first came on campus, I was a freshman, and it's just crazy to think that now I'm a junior. So it's definitely been like a rocky 15 months. But going back to campus, it just felt bittersweet in a way, because a lot of people are slowly coming back, and just looking at athletes wearing their masks and having people walk on campus. It just makes you at peace that we will soon come to this norm. So I honestly think that coming back to campus is it's going to be rocky at first, but it will for sure be something that we can all look forward to. Yes, I agree with Tyler. It has been easier to find parking, but yeah, so coming back to campus, I feel like it would be a great opportunity for everyone.
Thank you, Jessica. And now from our hardworking staff who've been on campus, Chris.
Thank you, Provost Jersky. I second everything I've heard so far regarding the parking. That's been very nice. Due to certain responsibilities of my position, I've been working on campus, since the initial shutdown. And so I don't think anybody would be surprised when I say that I've been stressed, concerned, frustrated, and definitely at times overwhelmed, as we all have. But looking back on the challenges we've faced, overall, I felt very fortunate, actually, most days that I've been on campus. Early on, working on campus allowed me to keep a part of my weekly routine despite the uncertainties imposed by the pandemic. People used to ask me, "Oh, Chris, how is it on campus these days?" And it was interesting because we would walk and do routine checks of the college, and it was almost like hiking archaeological ruins or something. It was very, very odd, because we've worked for so many years on campus. You're used to having so many people around, and all of a sudden they're gone, but everything else is still here. So it's very, very unique. But as we moved forward, I've continued to feel very fortunate to be involved in the planning for safe repopulation, and that continues to now as I assist those returning to campus in achieving their goals. My colleague in the Science Safety Office, John De La Cuesta, and I have worked to meet the needs of the college by providing training, disinfection supplies, and guidance to those resuming operations. It's been a very busy year for us, but it has also been a very rewarding year as well in all of the challenges that it has provided to be overcome. And we look forward to, continuing to meet those challenges.
Thank you, Chris. Inspirational. And Elle, how about your point of view?
Thank you. It's been, to us as a staff members here, it feels like an extended summer because during summer you don't see as many students around here or as many people. So it seems like it's just been a long extended summer through this whole event. We're glad to start seeing the students, and like the student mentioned, seeing the athletes come back. You'll see everybody, the signage like you see at restaurants. We took in a lot of effort to make the building safe for everyone and to accommodate the rules and regulations that are enforced on us right now. And we're looking forward to having everybody back here. Thank you.
Thank you, Elle. Bryon Jackson, ITS. You're muted.
Thank you. Sorry. Like Chris, I've been on campus since the start of the pandemic, and just to echo, much of what they said, as well as the ambassadors and the students have said, it's been somewhat surreal. Kind of Al said the extended summer. I kind of say it's more like the extended winter break working on campus. At first, we saw very few people outside of BBS and some of our folks. But it's been a good opportunity for us, knowing the eventual return of students is coming in the Division of IT to, prepare for that and build outdoor Wi-Fi and work on student laptop and hotspot loan programs. And so there's definitely been a lot of work to do. It's been great just to see the gradual increase in traffic on campus. We see students returning. In the beginning, it was just community members and a few employees, and now we're starting to see life return to campus, which is wonderful. The outpost is open. Throughout, Beach Building Services has done a great job at maintaining the campus. So it's been just a beautiful place to come, just without people for the past year. So very much look forward to getting back to whatever our new normal will be, but seeing a lot more students on campus and kids in childcare and just more life on this beautiful place.
Thanks, Bryon. It is indeed beautiful. And now to Ryan, who's also been busy.
Yes, for us in cashiering, we've never closed, so we've been open to the public during this whole pandemic. And luckily, I felt really safe coming onto campus. We've worked with the Environmental Health and Safety Department to make sure we always have masks and gloves, sanitizer, disinfectants available to us so we can get our work done in a safe manner. And I think for the team, we've really been mindful and respectful of all those social distancing and mask mandates. So, I think that's really, really great and important for everyone to feel comfortable and safe while being on campus. And also, I think the campus community at large deserves a lot of credit for really embracing that, One Beach spirit. Everyone who's come up to our windows has, had their face coverings on and followed the proper procedures so that everyone can feel safe. So that's been really great to see. So overall, a really positive experience during this whole crazy last year.
Thank you, Robert, and my apologies for reading backwards your name because I called you Ryan, but of course it's Robert Ryan. So
no worries.
Thank you for that, and my apologies. And now on to our two faculty members who here. To Tiffanye, tell us about what's kicking in kinesiology.
So much kicking in kinesiology. Thank you. I can echo, honestly, very much everything that was already said. I think at the beginning, it was incredibly surreal. We didn't know as much as we know now. And so I've really seen the shift in terms of policies, but there's always been a constant communication as to what's needed, what's going on. I would really like to, thank everybody that's been involved in terms of safety. I've always felt safe on campus. I think the college safety officers have done an outstanding job monitoring our classrooms. We still have face-to-face classes going on, and the continual delivery of PPE, cleaning supplies. We always had what we need. From that aspect, things ran as smoothly as they could, and again, very safe. And now as we progress, I also saw that excitement with the vaccinations. And so it's actually become a lot more fun every time I come to campus, and I'm able to see more and more faculty in their offices. You're conversing more with them, and it's beginning to feel more normal. And that's bringing back some of that excitement and that energy. And again, still remain very much in that safe bubble. So I'm very much looking forward to fall.
Terrific. Thanks, Tiffany. And last but not least, Miyuki Nakajima, also a faculty member. Explain your experience, Mimi.
Thank you. Again, I would echo what everybody else has been saying, especially what Tiffany is saying. It really felt safe, and I do appreciate all the protocols that were put in place. One of the things from a faculty standpoint, the one biggest aspect was we were back from fall, but the excitement of the students and the natural engagement that you get from the face-to-face, that was really there, and that was very different from the Zoom environment that we were in. So I'm really appreciative for all the safety protocol that was put in place so we could be there safely. The social distancing, the masking, all of those protocols were followed. The students were very respectful. We didn't have any case of COVID outbreaks throughout the last since fall. So we're very fortunate to have that. And again, the excitement, the energy that you get from the classroom was really valuable. So it was a very pleasant experience up until now. And I look forward to even in the fall when a lot more classes open up, and then we see a lot more students on campus. So thank you.
Great, thank you. Thank you all so much for that introduction and sort of a description of what life on campus has been like. We've had lots of questions, and I'm going to, just before we go to our experts, I'm going to talk about some of them. So some of you may have seen that the Chancellor's Office of the Cal State University has come out with a draft vaccination policy for the fall. Now, as you also know, this policy needs to be discussed with all our unions and with the statewide academic senate. And that is in fact being done as we speak. So because those deliberations are not over, I can't tell you what the final product is, but here is what the draft policy says. What the draft policy says is that vaccinations will be required of all staff, employees, and students. Now, like all vaccinations, there are exemptions. There is, like all vaccinations, a medical exemption. And as it happens, there is also a proposed religious exemption. And if that happens, there will be two options for all of us. Either we will be vaccinated, or if we come to campus, we will wear face coverings. And so it is determined by the scientists who deal with these matters, like the CDC and our California state agencies, that if we are vaccinated, it's perfectly safe to work in shared spaces, to have office hours with students, to sit down and enjoy lunch at the outpost with our colleagues. And if we are not vaccinated, then face masks will keep us safe. Of course, the implications of this and the details are still being discussed, as I said, with our unions and others. So the details will emerge as as they emerge, but that's the general plan. We do know that it's safe to share office space if you are masked or if you are vaccinated, and those will be requirements. As far as hybrid work goes, remember we, in the fall, will be offering about 45% of our sections with some kind of face-to-face component. And therefore, staff will need to be back on campus more than we have been in the past year. Of course, there are still online students, and we need to serve them as well. Whether that means that some staff will be working on a hybrid fashion is up to managers. And please make sure you speak to your manager about your personal needs. But it's our primary responsibility to serve the students we have, and many of the students and staff and employees, therefore, will be back on campus. In terms of what people can do, again, if there is a required vaccination policy, then everyone or most people should be vaccinated. Those that are not will have to wear masks if they're on campus. And so somebody asked a question about even students who are online classes will still perhaps need to access campus spaces, and that's true. And therefore the policy requires not just those who are on campus taking online classes, but anyone who accesses our on-campus services to either be vaccinated or to wear masks. In terms of PPE, it's protective physical equipment. And as far as the summer goes, in the summer we'll be moving towards the fall, but in general the summer will be more like it is now at the beginning of summer and more like fall at the end of summer. As soon as we know the procedure and policies for medical and religious exemptions, it will be disseminated, but it can't be disseminated till all our unions have been met with and confirmed. Okay. All right. The question about classes. So at the moment, as of now, we have about 45% of our sections face-to-face. Many of the sections that we are planning to offer have no students in them at all, not because of a bad thing, but because freshmen, for example, only start registering on June the 7th. And it is before that as we speak. For those of you who are watching this in a recorded fashion, it is the 20th of May. So we still have good 3 weeks before freshmen register. So if, for example, a faculty member, in accordance with the pedagogical needs of the class, want to change an AMI, alternative mode of instruction class, to a face-to-face, and there are 920 such sections, we can do that. And so please speak to your chair and scheduler. And I think that's all the questions I can get to just now. What I would like to call on is our experts. And that's just to remind us, Larisa Hamada, Jody Cormack, and Kim Fodran. So Larisa, the floor is yours to instruct us further about diversity and equity issues.
Great. Good afternoon or good morning, everyone. I'm Larisa Hamada. I'm with the Office of Equity and Diversity. And so we want to just give you a brief overview on the responsibilities of our office in our partnership and working with academic affairs. So for now, for workplace accommodations for our employees, including faculty and staff, if you have a medical need or an exemption, in your work environment, you may contact our office. Our email address is in the bottom title of my name. If you have questions regarding vaccine exemptions, which the provost has already addressed for both medical, pregnancy, or religious exemptions, again, we're still waiting for the Chancellor's office to provide us with a policy and further clarification. However, you may contact our office. Do understand for workplace accommodations, be it medical, religious, pregnancy, etc., our office will be assisting our employees, but it also will be based on the essential job duties, business operational needs, as well as safety requirements for the campus via the CDC and our guidance from the city, as well as their Dr. Fodran and the student health safety program as well. So also just for clarification, for student accommodations for medical exemptions for vaccines, as well as student accommodations for medical accommodations, that will be handled by the Bob Murphy Access Center. Our office will only be handling student pregnancy and religious accommodations. It's kind of confusing, so feel free to contact us if you have any questions. We do state that we are a tiny office, so we are anticipating an onslaught of student and employee requests, faculty and staff. So please plan on a minimum of 2 to 3 weeks for us to process your request. Many employees will need to provide medical documentation, and we're finding doctors' offices are taking longer than normal wait times to respond with that documentation. So please plan ahead, get in front of the queue, contact our office, and again, a minimum to 2 to 3 weeks wait time for us to be able to provide you with service. So please reach out to us in advance if you have any questions. Thank you.
Thanks, Larisa. Our next expert is Jody Cormack, the Vice President, who has been Dr. Repopulation. So, Jody.
Thanks, Bryon. So I think Bryon already did a great job talking about our course repopulation for fall. So just as a reminder, we did built our current schedule really in the midst of winter, before vaccines were available, when we were having some of our worst COVID outbreaks and spikes. So we did the best we could to anticipate where we would be both now and future into the fall. And we're adjusting as we have new guidelines and new conditions around which to work. So like Bryon said, we have about 45% of our section schedule on campus, and colleges are currently working with departments and faculty to see if there's any other sections that we can bring back to campus. So those might be sections that have no registrants, or we might take a course that's currently scheduled to be hybrid, and make that more of a face-to-face course. So we have those options. We may also be able to take some of our online courses that do have some registrants and offer some face-to-face options through HighFlex or adding additional sections. So we're still trying to meet the needs of everyone kind of in this transitional semester as we start to repopulate and we start to come back to campus. Bryon?
Thanks, Jody. That's great to hear. And our medical doctor, who has been working almost literally 24/7 for the whole year and still manages to smile and give us hope, Dr. Fodran.
Thank you so much, Provost Jersky, and good morning, everyone. So as Provost Jersky mentioned, we are still in a fluid situation, but at a much better point, I think, than at any point of the pandemic. Cases, hospitalizations, and deaths all remain very low and stable and are actually on a slight decline. A significant proportion of LA County has been vaccinated. But it's important to keep in mind that right now, up to 56% of LA County residents are not fully vaccinated yet, including our kids under 12. So it's important to still remain mindful. In terms of our campus, we've had very, very few cases over the past few weeks, maybe 0 to 1 per week, primarily students, primarily off campus. As Miyuki Nakajima mentioned, we have not had any outbreaks since the fall, which is all wonderful and promising news. In terms of our campus, We vaccinated over 11,600 students, faculty, and staff at our vaccine pod to date. As you know, we are doing a pause in our vaccine pod. Vaccine supply, however, is plentiful throughout the various counties throughout Southern California. So there shouldn't be an issue receiving a vaccine. Walk-up appointments, plentifully available. And I understand that this could be a very difficult decision for a lot of people. And there can be a lot of misinformation out there. So again, I just want to offer that student health is available for you. I'm available to speak if you just want to do an informal Q&A. There's, any questions that come up. We have sent, nurses, nurse practitioners, physicians out to various departments just to speak and answer any questions and concerns. As a reminder, for those of us who have not been to campus yet, if you run across a student or a staff member, another faculty member who is positive, or if you yourself are symptomatic, please continue to report that to student health. For students, there is an online reporting form that's either at the student health website or at the Reuniting at the Beach website. For faculty and staff, please report that up to your department chair or manager. And then in terms of returning to campus, if you haven't been back to campus yet, there is an educational component that may be required. It's an online, it's very simple and easy, but it just kind of gives you an idea of what the requirements are. And as Provost Jersky mentioned, things are shifting and changing, but in a good way. So the university abides by all Cal OSHA standards, wherever those might fall, come fall semester, as well as direction from local public health. So main takeaways, I would encourage you to continue to take care of yourselves and each other. Some promising news came out of local public health, LA County Department of Public Health, looking at schools K through 12 data. They actually showed that schools were actually really comparatively pretty safe with lower rates of infection than in the surrounding community. So thank you for everything that you've done, all the sacrifices that you made for wearing your mask on campus and getting vaccinated. And please continue to do your work to keep our campus healthy. Thank you.
Thank you, Kim. And we have lots of questions which I will attempt to answer or ask for the help of experts. So going right back to the beginning, how do we know it's safe to share office space? Well, we are relying on what our public health authorities are telling us. The federal, state, and local authorities tell us that if we are vaccinated or if we are wearing face masks, we are safe. At the moment, and this answers another question, at the moment, Cal OSHA is still requiring 6-foot distance and face masks for all. We think that will change, and when it does, we'll let you know. But so for the moment, we will continue not to share office space, and that's because Cal OSHA still requires the 6-foot distance. We think that will change. When it changes, if it changes, it will be safe to share office space. So the question of hybrid work is a very interesting one, and it's also quite complex. So listen up, folks. Prior to the COVID pandemic, so cast your mind back to normal in February 2020, Cal State Long Beach did not have a flexible or hybrid or telecommuting policy. Because of the emergency, as we all know, we all had to rapidly adapt to working from home by and large, and it seems to make sense to a lot of us that for some of us, not all of us, a hybrid work schedule may make sense. During the emergency, it's been, as it has been all through the summer, at the last summer and last year, during the emergency, it's been possible for managers to determine that many people can work from home. As we speak, the Cal State University system is working on a new hybrid work policy. That is not yet in effect, but we think it will be. It's obviously very complex and needs negotiation with our 13 unions and legal requirements and so on. When and if that comes into effect, we will have an official policy. In the meantime, it is, as I said, up to the manager to determine whether the person is needed on campus. Now, some people will be needed on campus for 5 days a week, and they will be informed of that by their managers. Some people may not. And so some people may continue to have a hybrid work status while the emergency, which COVID still is going on. So a complex answer, but we hope that we will in the future develop a clearer answer to this. Okay, some other issues. So here's an interesting question. Let's just, I'll read it because it's so important. My student assistant just advised me that she doesn't plan to get vaccinated. Will that prevent her from being or working on campus once we begin to repopulate? So let's just imagine that the unions have all been consulted. This is in the future, and the vaccination policy is largely as it is now. What we will be able to tell that student assistant is, you are required by the policy to get vaccinated. However, there are 2 exemptions. A medical exemption, if you have a medical reason not to get vaccinated, or a religious exemption. If the student does those, then she or he can still come to work, but will have to wear a face mask. And either of those 2 things, vaccination or permanent face mask wearing, are thought to be safe. So the answer is that it will not prevent her from working on campus, but she or he will either be vaccinated or wear a mask. I think I've addressed some of the others, but let's have a look at them. How will campus require that staff are vaccinated before returning? And so as the policy is being discussed, we don't know. But as the draft policy is written, what will be happening is that the campus will require vaccination, as I said, with those 2 exemptions being in place. And the campus will probably look at self-attestation. In other words, everyone will have to swear or write down in public under penalty of perjury that they have or have not been vaccinated. And the campus will be able to do spot checks. Again, we think and we know, I know that everyone here is honorable and will answer those questions to the best of their ability. Again, we accept that there are medical and religious reasons why some people will not be vaccinated, and those people will have to wear face masks. So that is that one. Everyone, or many people have asked, what is the timeline? When are we going to know? When will we be notified? And my answer to you is, as soon as we know, you will know. We don't know yet because we're in the middle of a rapidly changing epidemic. At the moment, good news. Numbers are going down in California and LA and in Long Beach. The variants seem to be under control. The vaccinations, which have been given, as Dr. Fodran said, to many, many people, 2/3 of Americans, by the way, at least have 1 vaccination as of today. And it's higher in California, which is great. But even though the vaccinations appear to be incredibly effective, not only at protecting you, but protecting the spread of the disease, there are other variants, as we know, in India and other unfortunate places around the world where the pandemic is still raging. And so we just have to wait and see. I wish I could give you an answer and say on this date, this will happen, but I can't. All right, some people asked about modifications in classrooms, like plexiglass on podiums or desks with 6-foot distancing and hand sanitizer. If you came in now, and of course there are no classes now, by the way, those faculty who are watching, I hope your grading went well, and today is the last day to hand it in, I think, so well done for all that hard work. And to our students, good luck with the results. And to our staff, thank you for making it all happen. BBS has invested in a large amount of plexiglass, and you should be able to ask for plexiglass if you believe you need it. At the moment, it's many people have. In the fall, we're not sure whether that will be needed, but if it is, we will have provided it. 6-foot distancing, as I said, at the moment, Cal OSHA still requires it. So if you come in today, we still need 6-foot distancing. We think that will change, and we think that in fall, we will not have 6-foot distancing. But that's just what I think based on information I have now. It may not be correct. And hand sanitizer, I think we're all much more aware of washing our hands, and the fact that I've been for 15 months without any flu or even a cold may make me wash my hands more obsessively than I ever have before. So yes, I think maybe we'll all carry a bit of hand sanitizer. So let me see if I can get to some other things. Sharing in closed spaces may still feel uncomfortable now. In places that are very small or very tight or that do not have windows, at the moment, that may feel uncomfortable. We believe in the fall that those things will change. And so, but certainly the university is always open to flexible spaces, and there are spaces to schedule which might have a more comfortable feeling. So just to quickly talk about how we know people have been vaccinated or how we know these things. Medical information, which vaccination is very highly protected by federal law, as it should be. And so we cannot reveal to general public anything about the medical information of any of our staff or students or employees. It's on a need-to-know basis, but as I said, we'll have a self-attestation policy under penalty of perjury, we think, and we will be able, we think, to do random checks. So we are laser focused on everyone's safety, but here's my feeling about this. I happen to be vaccinated, so I'm revealing that to you. I feel safe. And if I am in an enclosed space, I will wear a mask, and being vaccinated and with a face mask, I think I'm pretty invulnerable to COVID. And I may be wrong, but that's what I feel. So I hope everyone will share my confidence about the science. I know that not everyone does. Somebody asked, I'm sure, with good reason, will we expect there will still be classroom capacity limits in fall? And the answer is, it depends on what Cal OSHA says. If Cal OSHA says we still need, for example, to have 6 feet of distance, then the classroom will have severely smaller limits. If Cal OSHA says, no, you don't need to have any social distancing or 6 foot of distance, then the classroom would look much the same as it did before COVID, except perhaps the first row might be removed just to make sure that there is 6 feet of distance between the lecturer and the class, and so on. We will adapt, as we always do, to what happens at the time. Student workers are workers, and so they will be subject to staff guidelines. And of course, some student workers are represented, others are not. And if they are represented, the CSU will of course meet and confer with that union. If they are not, they will be following whatever the staff guidelines are. I don't think it will be necessary to bring your vaccination card with you to campus because you will probably be attesting, but that remains to be determined and depends on meet and confer with the unions. The question about will surveys, I think the permission to be on campus survey about health and others still be required for those who have been vaccinated. For the moment, it is still required, and we're all filling it out daily when we come to campus, but probably in the fall, it will not be required anymore. Plans to support social and emotional needs of students, faculty, and staff. I think I will refer that to an expert, because I do know that there have been plans by Division of Student Affairs and others on campus to boost these resources, but I don't know them offhand, so I will get back to you about that. A question, can faculty still opt in to teach with a mask even if vaccinated? Absolutely. There's no faculty can choose to teach. Faculty or staff and employees can always choose to wear a mask. So that's an easy one. The question about visitors to campus, our policy as it currently stands requires all people coming to access our services be vaccinated or wear masks. So that's the answer to that. Vivian, I think I got your question about the COVID pre-screen. Events and meetings on campus or off campus, when can we start doing that? I think the answer is it depends what the events are and what you mean by on campus and off campus. So we will get to that in an FAQ. For staff, can I clarify who a manager is in determining if a staff member is required to be on campus all days or certain days? Is that our ASM, Dean, or Office Supervisor? I think there's not one answer to that, but if you look at your job description will identify your immediate manager, and so certainly that's the first port of call. Somebody asked an interesting question, which I will tell you the answer to. We were told the vaccine would be effective for 6 months, and many of us received the vaccine in February or March. Will it still be effective in August when the semester starts, and will we need to receive boosters? As far as I know, the vaccine is effective for an extended period of time, but if the science tells us we need boosters, then to continue to be in vaccination status, we will receive boosters. Kim, is that correct, or is there different medical information?
No, you're exactly on point, Provost Jersky. This is a relatively new virus. I don't think there's any reason to think that if you got vaccinated in the spring that you wouldn't be protected. Just as a side note, companies like Moderna and Pfizer are working on flu shots with a COVID booster, but we really need to wait for public health and the science for recommendations moving forward.
Thanks, Kim. The question of will the computer labs be open to students? I think I will refer to Bryon. Can you let us know what the plan is there?
Well, based on, the situation's a little bit fluid, but as of right now, the library computer lab will be open, and each college I know is evaluating it as well based on whatever the new CDC guidelines are. But there are also online resources. We have student virtual labs, as well as we've worked with many colleges to have their labs also be available online. But for right now, the plan is to have computer labs open. There will also be an express lab in the student union as well. At least that's the current plans. If things change, it's like you said earlier, it's very fluid. We will adapt and change with it.
Thanks, Bryon. Okay, and back to the questions. I think I've gone through many of the questions. There are still many others. I think just to confirm what I said, because people are often wanting to know, even if you're vaccinated, can you still wear a mask? And so the answer is yes, of course. Anyone may wear a mask at any point, and that's always been the rule on campus, and it will continue to be. I think what I would like to just go back to a little bit is that events question, and I know that Jody actually knows much more details about this. So Jody, I think there's an events website, and so please enlighten us.
Sure. So we're looking at starting to slowly ramp up some events on campus, really waiting until after that June 15th reopening mark to look at approving activities. And then at that point, we'll start looking at activities. There's an event subcommittee. You need to submit your event. There's an events website that hopefully someone can find and pop in. If not, we'll put it in an FAQ. And so similar to our previous procedures, to have an event on campus, either as an internal on-campus event or bringing in third party, you need to fill out an event proposal, and then that will get approved. So now, of course, it's a little bit more complicated, and we'll be asking for the safety plan, the number of people, how you may do ticketing, all that kind of stuff. So there will be a safety plan that we'll need to look at for the events, but we'll start looking at those, ramping up slowly after June 15th through the summer, and then looking to bring more people on campus on fall as needed.
Thanks, Jody. And given that it's 10:55, and even though we have many more questions, just to remind you, the questions will be answered, all 72 of them. and we will get those FAQs onto our website as soon as we possibly can. But just before we go, I'd like to just quickly swing by our panelists again and ask you one positive question, which is, what are you most excited about to come back to campus or being back on campus? So, Tyler.
Yeah, for me, that definitely just has to be the socialization aspect of it, just talking to fellow students and just being reacquainted with them, like, you know, long lost old friends, being able to see them again. That's what I'm most looking forward to.
Yeah, thanks, Tyler. How about you, Jessica?
Yeah, so I agree with Tyler. I just also want to add on the interactions with professors in person. I feel like it's unmatched online. You know, I feel like I'm ready to go back to campus and actually have that one-on-one connection with my professors, and also, you know, connect with my fellow classmates as well.
Fabulous, absolutely right. How about you, Chris?
I too am really looking forward to, you know, reconnecting with all the faculty, staff, and students here on campus and seeing that vibrant campus university life, you know, come back in the fall.
Yeah. And Al?
I'm glad that they're going to come back, because it's great to be part of the process of the educational process, and knowing that we contribute to it by keeping the building safe for everyone and doing our part to keep the students safe and everything running. It makes us nice to see them come back and have the campus safe for them when they do come back.
Thanks, Al. And I just want to add a comment, which is that we are all so privileged to be here in the Cal State system and serving the almost 40,000 students we do. And gosh, I can't wait to see them on campus again. Bryon.
Yeah, so just to echo what everyone else has said, I mean, just the human element, having, you know, students, faculty, staff, community members, you know, back on campus, and to see see us do what is our core competency, which is educating students and seeing, you know, future workforces come through this beautiful institution. So I look forward to seeing people and having that heartbeat back on campus.
Fantastic. And this time I'll get your name right, Robert.
Thank you. I'm definitely looking forward to those like personal connections. I think on Zoom, you kind of feel that isolation after, you know, over a year. It'll be nice to actually see, you know, fellow financial management employees again and talk in person.
Yeah. And Tiffany and Mimi, you get to close off our show.
I would say hands down, it's going to be the personal interactions between students, staff, faculty, but I'm also very much looking forward to getting our research facilities and labs opened up for the hands-on learning that can occur.
Yep, wonderful. And Mimi?
I agree with everybody. Again, the human elements. It's happening now where I go to the office, and then, you know, the natural kind of a collaboration that happens just by walking down the hallway and talking to people. So there'll be more and more of that. So that is really something that I'm looking forward to in the fall. Thank you.
And what can I say but agree with all our wonderful panelists and experts, and thank you all for your efforts during the past really tough 15 months. We know that things are difficult, and as we transition back to a more normal environment, we focus on the human and emotional needs of all of us as we listen to the science and rationally respond to what we can do, while taking into account, as we always do, I think somebody said, the heartbeat of our campus, which is our people, that's you. And so thank you for listening. We'll put some FAQs up, and go Beach.